Stop doing so many stretches and hip mobility drills. In today's video, I'm gonna show you 3 things you're gonna get awesome results and you're gonna feel better doing it. Let's jump in. The first thing I like to work on is just getting a little bit of foam rolling done. What I'm gonna be using it for today is just kind of getting my glutes and hips loosened up. It's just gonna be rolling around, getting some movement in my lower back, in my mid back, and up and down my spine, along with my glutes. So what I like to do is I'll come here and I'm just gonna do some basic, simple foam rolling. If you don't have a foam roller, if you don't like foam rolling, or maybe you've been fused and you can't foam roll because of your fusion, then you can simply go for a walk. A fast-paced walk is a great way of getting things kind of loosened up without actually causing more issues in the process. So I'll go back and forth on each side, just kind of getting these muscles moved around, getting them smushed around a little bit. Then I'll go over to my glutes. Here, nothing too scientific. I'm just gonna roll back and forth. Try to get as many different angles of the glutes as possible. You don't have to overthink this. Just spend some time mushing these glutes out. Switch it up to the other side. And if you have your own special way of doing this that really works for you, knock it out. You can even throw a leg up on the other side here, really get a pull on that piriformis, and you're just kind of rolling it out. If this increases your pain, slow down, back off. You don't want to, again, cause more issues going into what you're gonna be doing to hopefully resolve them. So you got your warm-up done. Now it's the extensions. Yes, this is a low back mobility exercise or a stretch that you should be doing on a daily basis, especially if you have a history of low back pain. And I'll just focus on, I'll rock my hips back and forth. So what I'm trying to gain is just a relaxation effect in my low back. So I'm just kind of rocking, breathing. It's kind of hard to relax and talk at the same time. So just don't try to carry a conversation while you're doing this. Take some deep breaths, rock back and forth, and you'll notice that your low back starts to relax, starts to kind of let go and loosen up. Once you've gotten to that place, I want you to stay here. I want you to contract your glutes just a little bit, and you're gonna push up into that low back. All you're doing is you're gaining some extension. So you're gonna work up to a tolerance of what feels good to you. You can hold for time, or you can do it in reps. Either way, this is the #1 mobility or stretch that you should be doing, especially if you have a herniated disc, bulging disc, or any kind of chronic low back pain. We spend so much time sitting, working out front, right? Odds are people become, or odds are that you have become flexion intolerant, which means you can't do flexion. Flexion hurts, bending over hurts, sitting hurts. Traveling on a plane or train or whatever you do hurts, because in that sitting position, it hurts you. So if that's the case, you've got to give yourself the opposite motion, which in this case is extension. So once you've done this, we're gonna move on to the final exercise, and that will be the glute stretch. Hey, really quick before you move on, odds are you're in the gym and your workouts are either helping you or hurting you. The majority of the people that I talk to, their workouts are actually making their pain worse. If that's you, I've got a free guide that's going to solve that problem. It's super easy. It's called my pain-free training blueprint. You can go to fitnessforbackpain.com/pain-free training. I give you all the details on how I approach exercise from an intelligent perspective. You've got to train smarter if you have a history of a fusion, herniation, bulge, any kind of chronic low back pain. You want to exercise, this guide is a must. fitnessforbackpain.com/pain-free training. Let's get back to it. So there's a lot of hip and glute stretches that you can do, and it's really gonna come down to personal preference. This is one that I have found to be very safe, that most people can do. Obviously in your situation, proceed with caution. If you do not know whether you should be doing this or not due to a fusion, then consult with your doctor. That's the most important thing that you do. So I call this the leg over stretch, and basically what we're doing is we're modifying that old school traditional like leg up and just twisting like this. I don't like to get a lot of twisting and rotation in the low back, especially if you have a history of chronic low back pain. This is not going to be a stretch that you want to keep getting into, especially if your pain becomes worse after doing it. So you have to be mindful of how you do this, and I'm gonna show you how I want you to do it. So from here, I'm gonna take my left hand. If I'm twisting to the right, I'm gonna anchor myself here. So you can do it this way, You can do it this way, it doesn't really matter. I just like to try to anchor that shoulder blade, anchor that arm, to kind of give my mind a place to be like, okay, I need to make sure I keep this down instead of allowing myself to kind of come over here, okay? So I'm here, I'm gonna take my left leg, bend it up at 90, so boom, boom, there's your 90 degrees. And what I'm gonna do is I'm going to try to separate, I'm going to be taking this side of my stomach, right, this side here, and I'm gonna try to push it into the ground while I allow this left hip to start to rotate. And what you should feel is a very deep glute stretch, okay? You should not feel this in your low back. You should not feel a twisting like this in your low back. Instead, I'm anchoring myself. I'm gonna anchor that left QL area, and I'm going to just pull this across and let it relax. And what you have to be mindful of is as I'm twisting, I'm almost like I'm trying to take my upper body, twist this way, take my lower body and twist this way. So I'm kind of doing this type of thing. And what that's gonna do is gonna try to keep this low back from getting too much rotation or twisting while you're able to pull and get some stretch here in this glute. So what you'll have to play around with is where you're pulling from. Sometimes if you're really tight, just sitting here just like this is a lot, okay? Sometimes you have to play around with the angle of where your leg is at. You have to really kind of pull on it, yank on it a little bit, relax it. If you wanna take your heel and put it on the other quad on this right side here, and you can just relax it and hook into that quad and then anchor yourself. And then really once you get relaxed and you don't feel any kind of tension pulling or kind of cramping in the low back, then you can try to do some breathing. And the only thing I'm going to increase the stretch on is this opposite twisting motion that I'm doing. I'm driving this into the ground while I'm taking this arm and I'm trying to pull that right or that left knee across and put it in my right pocket. I'm gonna hold this, I'm gonna deep breathe, come in and out of it. You can hold for 30 seconds, you can hold for a minute, 2 minutes. Again, this is not something that I want you to go into. You're like, oh, my back hurts so bad, and I'm yanking and I'm pulling, I'm twisting. We're not trying to stretch away low back pain. What we're trying to do is gain some motion, gain some mobility in some key areas, especially after like a leg day, you've done some leg exercises, some lunges, some squats, whatever you're doing, and you have a lot of tightness in the glutes. That is me after a leg day. My legs get really sore and that really kind of pulls on my low back. So I do this to help release some of this tissue to open up my hips and allow my low back to not feel so restricted. Now we obviously want to hit both sides equally. So make sure you spend as much time as you do on the left side as you do on the right side, except when your pain threshold is being met. This is a big deal. Sometimes you'll have more pain, more tightness on one side, and to really gain a lot of movement in that area, you have to pull and yank on it. Don't push too much into your pain threshold. You have to learn to respect whatever that threshold is, whatever amount of time that is. Start small, okay? Don't think you can do this 1, 2, 3 minutes of just holding on day one. Go soft, go gentle, respect how your body's responding. Now, as a bonus, what you can do to finish up this little movement and mobility stretch routine is go back on your stomach, do some deep breathing. If you have kind of noticed a little bit of tightness after doing those stretches, maybe you allowed your low back to twist a little bit too much and it's not agreeing with you, the best thing to do is kind of get back into that parasympathetic nervous system, just trying to relax. Take some movement and put it in that low back. Try to take some deep breaths in. Once you've got it to relax a little bit, maybe do a few more reps of extensions. Coming down, we're not pushing into pain whatsoever. Contract those glutes, keep your hips pinned to the ground, and just try to work breathing and movement into this. You don't have to do as many as you first started with, but it's a good thing to do in a sense of just ending on some extensions versus just getting up and going about your day. Remember, keep it simple. So many people pick 3, 4, 5, 6
hip exercises or hip mobility drills. Most videos you see give you the top 9 stretches that you should be doing for low back pain. And it's just wrecking your low back. It's causing a lot of sensitivity that is unnecessary. Pick 1, 2 max stretches that you should be doing, making sure that you're always incorporating the most important thing, a good warm up, some extensions, and 1, 2 max hip drills a day. Don't forget, grab that free guide, fitnessforbackpain.com/pain-free training. If you're in the gym trying to use strength to get out of pain, but it seems like the workouts are just causing more pain, or maybe you stopped working out altogether. Don't do that. Learn how to do it intelligently. Train smart. fitnessforbackpain.com/pain-free training. I show you exactly how to train smarter, how to use core training, how to structure your workouts for your specific low back issue. Thanks for watching, and I'll see you on the next episode.